I wanted to go over the mock board skills assessment just really quickly. I did make some changes to it and I'll go over those with you. But I just wanted to go over really quick to kind of give you an idea of how this will flow. You can go ahead and start taking this mock board skills assessment once you've completed the fall instrumentation skills assessment and your ultrasonic skills assessments. Those are all things that are required for this semester. So once you've done those two skills assessments, you could go ahead and start with the mock board. It will carry over into the spring. So this grade, even if you take it in the fall, won't actually apply until the spring semester. But that way, if you wanted to get a little head start, you could. If the patient comes in and you wanted to go and treat them and knock this out, you can. But I wanted to go over it just really quickly so you know what to expect. The top of it looks just like your skills assessments normally do. And don't be afraid of this. It is a skills assessment. I don't have that across the top. It just says mock board. But bottom line, it's just another skills assessment. It just combines some specific rules and qualifications with your instrumentation and your calculus detection with a little bit of perio. So it's just, as the semesters go on, your skills assessments kind of build and grow as far as the instrumentation. This is just that next phase. So don't be afraid of it. It's another level of skills assessment, but it does help get you ready for your actual board exams. And we've kind of copied and pieced and pasted the requirements and the forms and things from both the CETA exam and the credits exam. The credits exam is the one that we host here on our campus in the spring. CETA is just another testing agency, very similar. Their goals are exactly the same, but just the wording and the way that they have everything put together is a little different. So we've done a combination here just so you're prepared either way. The first thing it talks about is in part 1, your patient selection. And that's where the biggest change that I made to the skills assessment lies. It was 12 pieces, but we've lowered that to 9 pieces. We've been talking about doing that for a couple of years, and the time was right to do that. So that is dropped down to 9 pieces, and I've adjusted the math all the way through. So if you end up with a mock board paper that says 12, just throw it away, because it's not just that the 9 pieces is going to be different, but the math calculating your grade later will be different. And you don't want more points taken off because the form is set up to do 12 pieces. So make sure and this is the one that's on Blackboard now, and I have some paper copies of it as well, but make sure you have the one that says 9 pieces, and at the bottom it says that it was revised October of 20. Okay, so we're going to scroll through. There's your definition of what is board qualifying calculus, and that's universally the definition no matter what board you're taking. Explorer detectable, moderate to heavy, and the sub-calculus is the most important part. They don't care if this person has ledges and ledges of supra. They want you perioscaling, so it has to be sub. So when you're, especially on anteriors, if you're checking for calculus, doesn't matter how much supra they have, make sure that they have the sub, because that's all that's going to count. There has to be a distinct, obvious deposit that's easily detectable with an 11, 12, or 17 Explorer. That definite jump or bump that binds or catches the Explorer, it binds and catches your probe also. It can be radiographic. It doesn't have to be. If you have radiographic calculus, it automatically is going to be large enough and dense enough to qualify. But if you've got pieces that are bumps and jumps and distinct solid pieces, they don't have to be radiographic. So radiographic is just one of the 5 ways it can qualify, but that is an automatic qualification. So just kind of keep that in mind. It doesn't have to be radiographic, but it can be. Okay. Minimum of 4 teeth in your selection, and I'll show you where you write your selection in a minute. Maximum of 9. You don't want, it's 9 pieces of calculus, so don't put teeth in there that don't have calculus. Just because you can pick up to 9 teeth, if you get those 9 pieces of qualifying board quality subgingival calculus in 4 or 5 teeth, there's no reason to put down 9 just to be safe. If you know you've got your 9 pieces, stop there. Let's see. So we've got 4 to 9 teeth, 9 surfaces of qualifying calculus present in your selection. Then it gets really detailed, so make sure you read through this a couple of times. At least 4 of the 9 surfaces should be on proximal surfaces of posterior teeth. So 4 of the 9 pieces need to be on proximal surfaces of posterior teeth. 2 of the 4 need to be on molars. Okay. The remaining 5 can come from anywhere in any surface of posterior or anterior teeth, but no more than 4 can be lateral and central incisors. Okay, so read through that a few times and just make sure you understand what teeth you're looking for, and how many of each teeth you need to make that qualification work. You can use third molars in your selection. For real boards, I don't really recommend it just because it's hard to get to them, but that again depends on the patient. If you can access those teeth easily, go for it. On the mock board, if that is something that you can get to easily and that gets you your 9 pieces, go for it. Following conditions are prohibited. You can't use a tooth in your selection that has class 3 mobility. If there's bonded retainers, like on your anteriors where they had ortho and they've got retainers, it just makes it harder for you to clean and harder for us to check. No implants, which hopefully they wouldn't have board qualifying calculus subgingivally on an implant anyway, but no implants. No partially erupted teeth and no retained baby teeth. Just because there's a lot of anatomy that you're feeling, we certainly wouldn't want to pull out or make loose a primary tooth that was retained. So there's too much going on with those types of situations. You don't want to use those in your selection. Now, that's not to say if they had class 3 mobility on one tooth and your selection of teeth doesn't include that tooth, you're fine. If they have bonded retainer but you're not picking any lower anteriors, then you're fine. This is more about individual tooth selection, not the patient. The patient can't have an implant. Well, sure, the patient can have an implant. You just can't include it in your selection. So hopefully that makes sense. If you have questions, just ask me. Part 2 talks about your clinical skills. You are going to be detecting calculus. You're going to be removing calculus without damaging the surrounding tissue. We don't want tissue trauma. You are going to be doing perio pocket depth measurement, and you are going to be timed. You have 90 minutes to complete the calculus detection, calculus removal, and your perio measurements. And I'll show you the form as we scroll on through. This talks a little more about the calculus detection. When we come over to do your check-in, we will assign the 3 teeth that you will calculus detect. They are typically from your selection, so you'll calculus detect those 3 teeth before you scale. Okay. With the calculus detection, I want presence of calculus. So board qualifying and non-board qualifying all need to be marked on the form, which we're going to get to. But you're going to calculus detect before you clean because these teeth are in your selection. If you forget to calculus detect and you go through cleaning, well, then it's too late. You've already removed it, so you can't check. And that would disqualify and be the end of it. So we don't want any automatic redos just because we got out of order and got excited. Once you've detected your calculus, you're going to remove your calculus. So you're going to go through, scale just your selected teeth, and this is where it gets a little weird. They may not be in a sequence. You may not have a quadrant. You may have, random teeth throughout the mouth. That's totally up to you. But you're only going to clean the teeth in your selection. So double check that selection a couple of times. We've had people clean teeth that were not in their selection. That's not that big a deal. It wastes your time, but it's not that big a deal. But we've also had people leave out, like they went through scaling and missed a tooth that was in their selection, and they had to redo the mock board because they had too many calculus errors because that particular tooth had 4 pieces on it. So Double check your selection a couple of times as you're going to make sure you're getting every tooth that you selected, because we're checking the teeth you tell us that you're going to clean. Okay, once you've done your cleaning, you're going to do your perio assessment. Again, you will be assigned the 2 teeth from your selection, and you will perio chart those after you clean. So you'll select your patient, select your teeth. Faculty comes over, double checks to make sure that that's going to qualify. Once we tell you to go, you have 90 minutes. You're going to calculus detect, clean, and then perio chart. Okay, so the perio charting is done after you've removed the calculus. It's more accurate that way anyway. And then when we come over to do your final check, we're checking for your selection to be clean and no calculus is remaining, and we do the perio check behind you. So we're checking the same thing you're checking. Now, here's how your grade is calculated. With the calculus detection, there's 9 scoreable items. Perio probing, there's 12 sites. Subcalculus removal, 9 areas. And then there's super calculus removal, because you will remove all calculus, whether it's just the 9 pieces for your selection or any other calculus that's present. You're going to clean the whole tooth and polish the tooth. So as of right now, we're doing the toothbrush polish, which is fine. Just make sure there's no plaque or debris on those teeth in your selection. If that means polish their whole mouth, great, but at least the selection, make sure it's good and clean. So that's how your grade is made. You can see how many points per item they're worth, and calculus detection and subcalculus removal are the biggest points. So make sure that you're selecting the appropriate patient, make sure you're calculus detecting well, make sure you calculus detect all calculus, not just the board qualifying, and then make sure you're removing all the calculus in your selection. Okay, so that's how the bulk of your score is put together. There are a few other things that can take points off. Improper record keeping, professional demeanor, infection control violations, that's 30 points. So infection control violations is an automatic redo. And we've had students of ours that went to take boards, and there were some infection control violations, and they had to retake the board. So if there's anything that could be a possible catch for your real boards where you've paid buku money, we want to catch them here when you're doing it for free-ish, and can retake it without a huge penalty. So 30 points for the infection control violation. Tissue trauma, remember we talked about removing all the calculus without damaging the surrounding soft tissue. It's 6 points for the first 2 errors. So there are 2 areas that you had tissue trauma. Once you hit 3 or more, it's minus 30 and it's a redo. Okay. Unprofessional conduct, I can't even fathom you being rude or abusive to your patient or faculty. But again, this is wording that came from some of these boards. So we put it in there just so you are familiar with it. The biggest thing here is failure to follow instructions and being unprepared. Now that I've seen a good bit. The students just hadn't read over the mock board. They weren't prepared to do it. They just had a patient that qualified, so they thought, why not go for it? Read over this. If you even think you might be having a patient come in, read over this. Just so you're prepared. It's a lot. It's very wordy. We did it on purpose because the actual clinical board exam candidate manuals are like 40, 50 pages long. We've condensed it here, but if you can't read this and follow the instructions, you're going to struggle with the real candidate manuals for the real boards. So being able to follow instructions is very important. That's why it's wordy. That's why it's a little complicated, to make sure that you can follow instructions while you don't have thousands of dollars on the line and a patient you had to find and all that stuff. Okay, so final case presentation. Again, this could be a redo if you didn't present your patient well. So what that means is that you've finished your cleaning of that selection, but you made a mess. Your operatory is a mess. There's prophy paste or blood or whatever all over the patient's face, all over the patient's napkin. You've just made a mess. So when your examiners or your instructors come over to check the patient, it's just a big mess. Well, that's not how you would present a patient for your clinical boards, so that's not how we're going to present them here. Just make sure your instruments are in order, your mirror's clean, your patient napkin is clean, your patient has been rinsed really well, things like that. Those are the kind of things that go into that case presentation. Okay, this is where your points will actually go. So if you had a couple of errors with calculus detection, no errors with probing, we would mark that all in the number of errors column, calculate it out with the points, and then calculate your total grade. Okay, so that's the skills assessment portion. These are the forms that you're actually going to use. So what you'll have laying out is the two forms we just went over, but then you'll have it flipped over to this page. So you've got your candidate information. Don't put your name, but you're going to put the date, the operatory number. If there's any kind of medical alert for your patient that we need to be aware of, you'll mark yes or no and then kind of explain in this little column. If there's a lot going on with your patient's medical history, you could just write C medical history or hypertension or whatever the medical alert is. If it's simple, write it out. If it's something really complex, just put C medical history and we'll open it up and take a look and see what's going on. Okay. Section 3 is where you're going to tell us which teeth are in your selection. So minimum of 4, I've repeated it again right there. Minimum of 4 teeth, maximum of 9, and you're going to list out the tooth numbers. It's nice when they're in order. Doesn't have to be, I don't guess, but it's nice when it is. It makes us, able to go through a little faster because remember, you're going to have 2 instructors. So the 2 instructors are going to come over and double check your selection to make sure that within those teeth that you've listed right there, that the patient has 9 pieces of board qualifying calculus. Okay, so that's where you're going to tell us your selection. If there's anything else that you can think of that you need to tell us, because you won't be talking to us, if there's anything else that you can think of that you need to tell us, patient is extremely sensitive, tooth number 14. Okay, there's a little section where candidate can comment to the examiner. Okay, so you'll make a little note there if there's something that we need to know. Okay, there's another little section next to it, examiner comment to candidate, if there's something that we need for you to know. Okay, I cannot think of anything that we've ever written there, but if there's just something that we see that we want to make a comment there. If the patient came in, I think this actually has happened. The patient came in and they already had tissue trauma. Let's say they had chips or something the day before and they had cut a part of their gum. That happens to be a tooth in your selection, or maybe it's not. We could make a note, tissue already has trauma present and whatever area. That way, we noted it at the beginning. We know that you didn't do it during your cleaning, so points don't come off at the end. Okay, so things like that. Those are the kinds of things that we could make notes right there. Okay, so when you come back into the operatory after the 2 instructors, 2 examiners have checked your selection and approved your selection, we will also have already put down the 3 teeth that you will calculus detect. Okay, we'll also have the numbers in here for the 2 teeth that you're going to perio chart, but remember that comes after. So you come back into the operatory, your selection was approved, and you've got your 3 teeth to calculus detect. We will have already done it while we're over there. So our calculus detection's already done. You'll calculus detect your 3 teeth, and then you'll clean your selection. Okay? When you're done cleaning your selection, whatever, between the 4 and 9, however many teeth you have in the selection, okay, when you're done cleaning that selection, then you're going to perio chart the 2 teeth. Okay, so once you've got your selection clean, you've got your calculus detected, your selection is clean, and you've perio charted, Then you're going to let faculty know that you're done and ready to be checked. And remember, you've got 90 minutes. There's a little place right there where, it's right there at the top. The second examiner puts your start time right there. And so we know when you started, you've got 90 minutes from there. So when your 90 minutes is up, or when you get done, you'll come let us know. Or if your 90 minutes is up, we come let you know. And then we come back and check. And again, it's 2 instructors. It may not be the same 2 instructors, but it'll be 2 instructors. So a question that always comes up, what happens if I start my mock board? I've got 90 minutes, but the session ends and we have to dismiss patients. Well, what happens there is what would happen in a normal clinic day. Your 90 minutes, we put an end time when the session is over. You dismiss your patient. When they come back, whether it's after lunch or another day, when they come back, you let us know, hey, I'm in the middle of doing my mock board. We come over and give you a second start time and however much time you have left. So if you clean for an hour, but you've got 30 minutes left and you don't feel like you're done, then when the patient comes back, again, either that afternoon or the next day, we'll start your time again. So you don't lose time. If you run out of session and you're not done, you still can bring that patient back. It doesn't mean that you didn't get to finish or you get less time. Everybody gets 90 minutes no matter what. So just keep that in mind. It's a workaround that we had to come up with to make this work in clinic. All right, so now you're done. You've done your calculus detection. You've cleaned your selection. You've perio-charted your teeth. So now you let us know that you're done, or your 90 minutes is up and we come and let you know that you're done. So now examiners are going to come over. You've got a square for examiner 1 and a square for examiner 2. Whoops, and I got crazy with that. So examiner 1's going to come over. We already have this calculus detection filled out from your check-in. We're going to go through, explore through, make sure all of your calculus is removed, and that goes on this other form. So there's instructor 1. We would chart any calculus that was left over and perio chart your 2 teeth. So then examiner 2 comes in. Again, their calculus detection is already filled out. They're going to do the perio charting and their calculus detection. And again, it's just of your selection. So this would be marked, the teeth on this chart would be marked from the selection that you gave us here. So we're not checking everything, we're just checking your selection. So just keep that in mind. If that ends up being one quadrant, great. If it ends up being, teeth kind of scattered all around the mouth, that's fine too. But, just kind of keep in mind how that order goes. Also, you can see down at the bottom where it says revised 10/2020 SB. That's me. That's the new one. Like I said, that's the one that has the reduced number of pieces. 12 pieces was just taking too long. It was hard to find a patient. So we've talked about for several years reducing that to 9. So anyway, that is the mock board explained in a nutshell. If you have any questions, let me know. I'll be happy to explain it. But otherwise, that's everything you need to know. Good luck.